I'm a member of both organizations.
So just to give you all a quick synopsis, we're going to discuss healthcare reform, and inside that topic, especially ObamaCare. So, that's not cool. Aaron, take it away.
So what is ObamaCare, or also known as the Patient Protection and Affordable Care Act? The plan is a national healthcare plan aimed at reforming the healthcare system, and it will be going into effect in 2014 and full implementation if, as we talk about later, it's upheld.
So what are its origins? The first origin is the Heritage Plan from 1989. It was a plan developed by the Republicans, which mainly focused on the individual mandate. The individual mandate is a mandate that states that everyone has to purchase health care, which is key to ObamaCare now. And following that, we have ObamaCare from the 90s when he was the governor of Massachusetts.
At this age, you don't necessarily want to take on a health insurance plan because you don't feel like it's like I'm pretty healthy. I don't have like pre-existing health conditions and things like that to worry about. So it's really beneficial then for families as well as young students graduating college.
And then moving that way as opposed to going backwards. So I think that in terms of who's at stake, it's everyone's at stake and no one's at stake, because you can't point to one group of people and say that they are primarily responsible for this, but it's more cyclical than that, I think.
Just kind of piggyback on the doctor point, you also have to think about who, you have not only hospitals caring for patients, but you have private practices. And as such, they're going to have to cover the cost of, buying the extra machines, buying all the tools.
This is actually what I wanted to make earlier, is that we have, as Ziki said, universal health care in the way that he said it, but also, people, if you go to the emergency room and you don't have health insurance, they're required by law to treat you. The type of treatment that you get is can vary definitely, but that's kind of our way at this point of dealing with people that are uninsured, and that causes huge cost issues.